Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. Welcome to class. The class today is on collisions, and it would be different than I've given you before. For those of you who have been, do any of you have any questions before I start? Any at all? Welcome, Denise.
Hi, Pop.
Okay, so no questions. So today we're going to talk about collisions from minor to major. And I'm going to share with you, first of all, things you can do to prevent collisions. A small collision can be something as simple as you stubbing your toe on the bedpost. Probably most of you have done that.
Mm-hmm.
That's a minor collision. That can have a long-term negative effect. If you hurt your foot, big toe, little toe, doesn't matter, and you limp, then it changes the alignment in your knees and your hips and your low back and your shoulders and your neck, the way you swing your arms. And if you have a compensation in the spine from misaligned or injured collision toe, you can have organ malfunction. Keep in mind the concept of vertebral subluxation. That's when two vertebrae are misaligned, one upon the other. We call that a segmental subluxation. You can also have a regional subluxation. A regional subluxation is where you have a change in the curve. In the spine you have three major curves. You have a low back curve, the lumbar. You have a mid back curve, the thoracic. You have an upper spinal curve in the neck. If any of those curves are modified rotationally, you have a regional subluxation. When you have a regional subluxation, you can have multiple reductions from nerve flow to organ tissue. You can develop a bowel problem, a kidney problem, a stomach problem, a lung problem, heart, head, from stubbing your toe and having lingering compensation. Sometimes the compensation does more damage to you than the trauma on the foot. Often people have toe jamming when they get up at night and walk and they can't tell where they're going.
Does it have to be night? Because I
It can be
can stub my
day-
toe in the middle of the day and I think, where did that come from?
It could be daytime. So from a standpoint of prevention, I'm a big believer in nightlights. For $5, you can buy a light that looks like that or something different. Turns off in the daytime automatically. When it gets dark, it comes on. You'll never have to worry about where you are at nighttime. Now I speak from my own negative experience. 2 years ago, on September 20th, I got up in the night. We were in our fifth wheel up by Hackney, totally black. I went to the restroom, the small restroom, and our bed was there. I was going to put my hand on the bed to get back in bed. I didn't know when I was in the restroom, somebody moved the bed. So when I went to put my hand on the bed, it was gone. And I went clear to the floor and broke my hip. Now that was not a good night. The pain was excruciating. And I know enough about the body to consider what could have happened. And it felt to me, based on pain, that I pushed the femur through the ilium and broke that. It was a bad couple hours to get me out of there into the car, into the emergency room to get it checked. Fortunately, it was only a break across the head of the femur. That would not have happened if I'd had a $5 night light. You could see where things are. Now, within the last month, I've seen a few men who have got in the shower, when they got out of the bathtub shower, slipped, unlanded with the ribs, broke ribs, hit on the top, hit head on the toilet. They could have all been prevented with one of these little gizmos. I'm a big believer in these little gizmos. I think this should be abundant. Now, a lady yesterday in class, whose husband has been gone for 10 years, said, my husband put those up a long time ago. And I said, why? And he's told me, one day you'll need them. Well, the day came. Now she depends on them. Mm-hmm. So, as I was in recovery for my hip event, I had them installed in my bedroom. So now I have a couple on each end of the tub, and
where else do you have them, Dr. Smith?
I have them going down this 3 steps into the garage, a long one and a short one on the shelf. So when I go up and down there, I can hang on. And when I had crutches and couldn't put weight on my leg, going down the stairs was a traumatic experience because of balance. So I recommend those abundantly from a standpoint of prevention. Now we'll go out into your car. You've heard this before, so I'm going to quiz you.
Oh, my hard drive just erased.
We're talking now about headrest. Never buy a car or pickup without a headrest. Why? Because if you get rear-ended at a high speed and have no headrest, you can very easily pop your head off, and your head could land in the back seat, and that happens. You kind of smell, but that happens if you talk to a highway patrolman who investigates high-speed crashes on the interstate. You know, sometimes people pull over, they get hit, boom, the head goes into the back seat. So you need to have a headrest. Now, let's talk about the headrest. Would that be tall enough for a headrest?
No,
No. Why?
that would be neck. Your head would still go back.
I recommend you have a headrest at least twice that high. Next time you go car shopping, that's one of the first things you want to check is the headrest. The headrest, to be properly fitted, should be high enough that the middle of the headrest is about 1.5 inches above the center of the back of your head. If your head's round, not square, that's easy to find. Okay, the center of the back of the head. Why an inch and a half or two higher than that? Because when you get hit from the back, the spine gets shoved. What happens to the head?
Rises.
Goes up. If you get rear-ended, you're going to get the curve in the middle of your back is going to get sheared and elevated. So your head's going to go up. That's why you want the headrest higher, because your back will move before your head ever moves. So if you take high-speed pictures of your body in a car, the head doesn't move until it's used up the curve, and the head finally, the car hits the head. Did that make sense?
Mm-hmm.
So when you have that, I'll talk now while I'm here about the damage. The damage that occurs in the body starts here, but right through here in the middle. Those vertebrae get slid forward. That's called shearing. Shearing is like scissors. And then so you get the two that are furthest back, then the ones above and below, shear, 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 shear. All of that happens. You won't want to remember this number, it's not on the test. But 1/300th of 1 second. Boom. Okay, it happens very fast. And they do crash impact scientific studies to document what I just said to you. Now, to further protect you from damage, if you're ever in your car and you hear a screech, like somebody behind you trying to stop, don't look in the mirror. Mm-hmm. If you turn your head, the damage is worse, always. If you have a passenger, like your spouse or a child, and you go like this, you're going to get hurt worse. Don't do that. Have them secured. If it's a child, they're going to have the back of the seat, or they're going to be in a chair of some kind. Keep your head straight. You should push your body back into the seat. And if your headrest is adjusted properly, the headrest will be within 1 inch of the head, back of the head. Higher, within 1 inch. Why 1 inch? We don't want the headrest close enough that when you're driving and you get kind of tired, you can lean your head back. We don't want you to be able to lean your head back and touch the seat. If you have any kind of hairstyle, you don't want to smash the hair. So if the headrest is touching your hair, it's probably okay. But if you have a fluffy hair, you need to smash the back of your hair. You can fluff it up when you get where we're going. Why do you want that? Because you don't want to get hit harder by the car. So ideally, to lower the damage to you, you put your head on the headrest, you brace your feet, and you hold on the steering wheel. You become what's called one with the car. always become one with the car upon impact. Now there are a lot of rumors going around saying, oh, Bill was drinking and he got in a car accident and he didn't get hurt because he was drunk and loose and he flipped around. That's a lie. Don't buy into that. You have less damage when you secure it here, and have the headrest properly fitted. Now, if the seat is too far back, you've been traveling a long time, you want to slide your seat way back and lean back. That's a very dangerous position because when you get hit from the back and crushed, you get thrown forward. I'm not a proponent to tight seat belts unless you're going fast. And we have seatbelt laws, and they have value. But around town going 20, 30, 40 miles an hour, the seatbelt does not do you much good because the purpose of the seatbelt is to keep you in the vehicle. Okay? Person that I see who was with a boyfriend in a pickup with no seatbelt and they were at high speed, she got thrown out and killed her. Now she would not have probably died if she had had a seatbelt on at the high speed. I have another person that I treated in Colorado who had her seatbelt on tight in town, and somebody pulled out in front of her. She hit them. The seatbelt was too high, too tight, and she folded over it, had excruciating back pain. They took her to the hospital. That seatbelt caused too sharp of a bending and fractured two vertebrae, collapsed them. So they cut her open from the front. We went through, moved everything out of the way, put a couple of little metal straps along the side of the vertebra, lifted them up, put them back about the right height, put screws on both sides, had them on both sides, sewed it back up. You lay in the hospital and said, I have a really sore hip. And they said, yeah, well, you were in a car accident, you got thrown around, and we'll get you back fixed, and you'll be able to go home in about 10 days. And so I went up to see her, and she said, my hip really hurts. So I said, when you get out, stop on the way home. I want to check you close. So she got released, got into the car, came to my office. I weighed her with two separate scales. She weighed almost 100 pounds more on one foot than the other. She had a lot of weight, but she was way, way, way off. So I said, okay, next thing we're going to do before I even touch you, I want you to come in that X-ray room. We took X-rays of her whole spine with her standing up. Her femur head was broken off. So when she hit her knees on the dash, it sheared the femur head off. I said, no wonder your hip hurts. I'm going to make a call. I'm going to call Dr. Matthews, your orthopedic guy, and tell him he has another job. And you get in a car, go right back to the hospital. And so they replaced her hip, gave her a new one. But guess what happened in the whole area over that 10-day time period? She got a lot of infection, she got a lot of degeneration, a lot of lymph node was bad. She went then from the hospital to intensive care kind of facility for a couple of months. Then she went to a rest home, and within 6 months of the injury, she died from the infection in the hip. Now, that's why I've always been a big believer in when somebody has a crash of any kind, even at a low speed, the speed was about 40 miles an hour. You check everything. A lot of people get rear-ended, and they get, because the head gets thrown back, the jaw stays, the head comes back, and they develop TMJ problem because the whipping in the jaw area. A lot of people get pain above and below the curve, here and here. That's where a lot of damage occurs from the shearing effect. A lot of people get knee, sometimes ankle, sometimes wrist, sometimes elbow, shoulder, all from a light crash. Now, if you have a crash, low speed crash, and you get out and you look at it. I saw one yesterday on Channing and 17th, a couple of girls. Boom. They get out and they were talking, waiting for the cops or somebody to come and take care of them. They don't think they're good, they get hurt. You should write this down. If you're ever in a crash, you'll always get hurt worse than you think you did. And if you say, "Oh, I'm okay," everything you say, they record. The cop says they didn't think they got hurt. Now, like the girls yesterday, there wasn't much damage done to the car. Now, just so you know, the greater, you can remember this, the greater the damage to the car, in other words, the more the car bends, the less damage to the occupants.
Okay, I have a question on that. My grandson this summer was hit on Bribery Highway from a lady.
Yep.
He rolled like 2.5 times, slid down the highway, had his seatbelt on, and they took him to the hospital, and they were all like panicked, he's gotta have something. They didn't find anything.
Yeah.
But there's something, damage probably done.
Oh, for sure. For sure. But what did they look for in the hospital? 2 things major. Number 1, broken bones and blood. Right?
I don't know what they checked for.
That's what they check for.
Obvious signs of damage.
Obvious signs of damage, bleeding and broken bones. And that's, the good news is, bleeding is relatively easy to stop, unless you sever an artery, big time. Broken bones have a very high vascular content, and they heal quite quickly. Like when I broke my hip, they said don't put any weight on it for 6 weeks. Well, 6 weeks seems like a long, long time when you have it, but in reality, 6 weeks is nothing compared to 80 years. Okay, it's not very long. And then they say, okay, they x-ray it to make sure that it's mended. Now, mended means it's not going to slip and slide and move around. Here's a question for you. How long do you think it takes a bone to heal completely in time? Weeks, months?
The doctor usually says a year.
Pardon?
The doctor usually says a year.
And the doctor's right. It takes at least a year, at least a year.
How long does it take for soft tissue damage to heal?
Okay, let's talk about soft tissue. That's a perfect question. What kind of soft tissue do you have? Let's start at the foundation. Soft tissue. We have bones. We hook bones together with what? Ligaments. You have about 800 ligaments in the body. What do? The only thing they do is hold bones together. That's soft tissue. They have almost no direct blood supply, therefore they heal the very slowest. And ligaments always heal best when not moved. So if you think you damage a ligament, try not to move. The next tissue are tendons. Tendons connect to bones. Between one tendon and another tendon is a muscle. So that's the next level. So tendon to tendon on one end, bone, it's attached to bone. I have tendon, muscle, okay? Inside the muscle, we have arteries, which feed it. We have veins that drain the blood. We have lymphatic vessels that clean the things out of your tissue that are too big to get into the veins. You have nerves that go into the muscle. Without the nerve, the muscle doesn't do anything. Oh, how many tissues is that?
2.
Ligaments, tendons, muscles, arteries, veins, lymph. That's soft tissue. It's all soft tissue. How long does it take them to heal? Well, they're all different. Which one's going to heal the fastest? Probably the muscle. Then maybe the arteries or the veins, the lymph. What about the nerves? You can damage a nerve. How many kinds of nerves do you have? You have motor nerves that go to the muscles that tell it what to do. You have sensory nerves that go from the muscle joints back to the brain to tell the body where the brain where the body is. All joints have GPS units to tell your brain where the joint is. That's why when a fly lands on your shoulder, you don't have to hunt for the fly and talk to your arm until you can feel it. And your body knows where it is, and you can go back and scare them away. Unless you're really fast.
Okay. I was just wondering if you didn't kill God's creatures.
You just scare them.
Depends on where if they're in my house or out of my house.
Amen.
Now, did that answer the question about soft tissue?
So muscles, ligaments, tendons, nerves, and blood vessels are all soft tissue. Did I miss one?
Lymph.
Lymph?
And those can take a long time to get through this whole system, I would think.
If you damage a nerve, they figure they grow about 1 millimeter per month. That's pretty slow.
So what does that, I'm not good with millimeter. My doctor told me 1/4 inch per year.
1/4 of an inch per year. Well, there are about 7 millimeters in 1/4 of an inch. So it's close. It kind of depends on where it is. Okay, they're not all the same. Like peripheral nerve is different than a spinal nerve or nerve to organ. But that's a good range. It takes the bottom line, it takes a long time for them to heal. And sometimes they never completely heal. But when you damage an artery, the body makes new arteries. The medical word is anastomosis. So if that was a nerve, if that were a blood vessel and it got damaged completely, the body would make new ones to go around it. Multiple new vessels to go around the old one that was damaged. Same with nerves. If you damage a nerve, your body will make a whole bunch of nerves, and it will be what they call neurologic supersensitivity. You may have one nerve damage, you get 5 new ones. So the tissue for a long time is super sensitive. I think that's a gift to you from God, so you don't mess with the damaged tissue. It's more sensitive. Then eventually the weaker ones die off and you end up with 1 or 2 to replace the one that was damaged. No.
Amazing.
I was just gonna say, it seems like
It's amazing.
when you get an injury, 6 weeks is kind of like the acute phase of whatever injuries are, and after that, it's really easy to think, oh, I'm healed now,
Yeah.
because I'm through the acute phase and it doesn't hurt as much, and I can go do all the things that I was doing with it before.
Thank you for mentioning that, because when you have an injury of any kind anywhere, whether it be a stub toe, car accident, slip and fall on from the water slide. I have a lady right now who did that about a month ago. Family reunion, boom, hit her head, major damage inside the head. I saw a fellow this morning who tipped his tractor over and hit his head and his arm and his ribs, and they first check for bleeding, so they do a CAT scan. Oh, you have no bleeding, you're okay. And he says, no, I'm not okay, because what happens, the bones in the head get jammed. You have any kind of a crash, and a kid falls off his bike and busts his head. He goes to the roller skating rink or the soccer field and has a head-to-head trauma. The sutures in the head get jammed together and they don't move like they could or should. You fall on your butt and you jam your hip, so it jams the sacrum and torques the lumbar vertebra. So you have a sprung tissue, sprung. It didn't tear, it just stretched crooked and got jammed and stuck. And when anything gets stuck, whether it be your foot, your knee, your hip, your neck, it creates compensation in the function of almost everything.
Can it cause mental, anxiety, depression, any of that?
Any kind of, from my experience, any kind of anxiety, depression, always I've been able to find significant cranial, I would call it aberrant motion or no motion.
Okay.
And if we talk about prevention, the exercise that you do with the sacral slide, you keep the sacrum and the spine mobile. The exercise you do with the occipital release and the microcranial mobilization, that keeps the head mobile. Now, the greater the normalcy of the mobility, did that make sense?
Mm-hmm.
The less damage will occur upon injury. Now, let's talk baseball for a minute. We have a pitcher who can throw a ball 95 miles an hour. It's a little hard ball. If we hit it with a hard bat, right square in the center of the ball, the center of the bat, they call that a what? Home run. Okay. That technically does the most damage. What if we have a foul ball?
It's off the side.
Bounces. So we can take a lesson from that. If you have a fall, like you trip, you fall, make it a foul ball, not a home run. So you kind of roll when you go down. You keep the motion going. You don't go boom. If the harder you hit, the greater the damage. Now back to the car. I said to you, if the car doesn't get bent like those girls the other day, their car didn't get bent much. They got hurt way more than they would have if the car would have collapsed. Why?
Because the car took it, not them.
Exactly. Now let's go back to the ball field. Now we have a different ball. We have a different bat. We have a wiffle ball. And then we have a soft bat. Okay?
Mm-hmm.
Can you hit a 380-foot home run with a wiffle ball? You can't do it. Why? Because it gives. So next time you have a crash, if you do, hope the car got smashed bad. Why? Less damage to you.
Was your car smashed bad?
I've been in like 5.
Some of the most significant traumas with lingering effects that I've seen have occurred at low speed. I had a lady right now who was in the parking lot, somebody in a big pickup hit the front left side of her car and moved the car, and she didn't see it happen, so she got torqued. When she came to see me to see how she was doing, I had to walk the hall. She wobbled. It was like 5 days after the crash. Her greatest pain was in her knees. Why the knees? Because she was sprung. Her body was torqued. So when she walked, every step was a compensation of a wobble. No direct impact, all compensation. She had no knee problem with either knee before. Now she had new pain in both of them. And for them to get, her knees to get healed, her body needs to unwind and get back to alignment. We talked a lot about motion, balance, and alignment. Those 3 things are very, very important. They are more important by far than pain. Pain is very poor determinant on the intensity of the damage. Like when you stub your toe and it hurts at a level 10, there's nothing life-threatening about that, but it hurts really, really, really bad. Then you can have a stroke or a heart attack with almost no pain. It's going to kill you. Okay, so let's pass this around. Do any of you have any questions on what we're talking about?
Why do you have the earthing book there? Does that have to do with what you're talking about here?
No,
Okay.
it's there because sometimes people like to borrow them or read them. If you'd like to borrow, you can look at
I've
it.
got one. I just wondered if grounding was part of today's thing. So
I do teach grounding. I'm all in favor of grounding. In fact, I buy grounding pads and market them to you because I can get them at a discount. Same ones you buy on Amazon, but I can get them for you cheaper. I believe in them. I use them. I have a lot of people who use them. Do you have one?
I've got a couple small ones. Yeah.
Bottom line is Mother Earth gives off energy. When you hook up to Mother Earth, you get some every night.
Did you try putting a rod into your hanging plant to see if it made a difference? Remember we talked about that?
I haven't done that yet. Would it make a difference? I think so. All my trees are grounded, all my flowers are grounded, except those that are hanging on pots. But they're hanging on pots that are grounded because they're hooked onto the steel post.
Oh,
But they may have a plastic holder which would take it away. Any other comments? Number one, the majority of negative effects of a collision may occur long after a crash. 2, it is probable in a motor vehicle crash to have multiple collisions with different body parts.
True.
3, usually in a rear-end motor vehicle crash, there are both direct impact injuries and rebound injuries. True. Now, the other day, it might have been you, Betty, the question came up about, or Kathy, about the brain trauma from a crash. If the head gets hit, you have the direct impact of the head hitting, like the headrest hitting the back of the head. That causes the trauma between the bones of the brain, the cerebral spinal fluid. We talked about that last week. Protects the brain. And then you get the rebound, which then goes forward, throws the brain to the other side. Sometimes on a high-speed accident, the major damage is from the first impact. On a lower speed, it may be from the rebound. Either
So
way.
you'd get bruising on the other side of the brain rather than
Yes.
hit one side that was hit.
And the bottom line is, from a diagnostic standpoint, if they do a CAT scan, they'll find it on either side. From a therapeutic standpoint, if you get hit from the right, your body will get sprung to the right. Unless you get hard enough that it whips back the other way. You can have both.
So in a whiplash case, you get hit from behind, your head's thrown forward. It's hitting the back but thrown forward, and then it rebounds back, so you get both forward and back. Muscle tear, tendons, ligaments damaged, that type
Exactly.
of thing.
On both the front of the neck and the back of the neck.
Okay.
If your head's turned, it's always worse.
Yeah.
Then you're messing with the nerves that go down the arms and back up in the head. That's why you don't turn your head.
But this is automatic for moms. I mean, we're gonna protect our kids. We don't even think about that, so
So
we're,
let the kids go. They're replaceable. You can get another one.
with some of them maybe, but not.
Now, I could agree with the dog, but come on, that's going a little far.
Yeah, people who drive with dogs in the front seat, I think should be.
Breathe deep.
Number
Dogs
4.
Slow it out.
Number 4, usually after automobile crash, the bodily injuries have recovered within 12 weeks of when the major pain is gone.
Oh,
Now, that's in there because if you've ever been in a crash, the insurance people will call you, "Hi Val, how are you feeling?"
Just awful!
That's what you say.
Okay,
you
but you
never
might
give-
have symptoms gone by then and you feel fine,
And you lie to them.
but you're still damaged.
You're not done.
You're not done.
You're not done. I would say never, under any circumstances, release an insurance company from their liability within less than a year. And I think given that is too quick. Almost all policies will say they have you cover for up to 3 or 5 years after the policy. I would recommend you not settle, not close until right at the end. Why? Because many times you have delayed effects. Well, stubbing a toe on anything can lead to a shoulder and neck tightening and pain. Yes. I could have put stomach problem, lung problem, all would have been true. Now, this is where a lot of you, this applies to a lot of you. 6, pre-existing degenerative tissue predisposes to greater damage and slower, less qualitative recovery.
True.
Very, very true. Now, it's very common for people who have a minor injury, when the pain subsides, they think the pain's gone, I'm okay. They overdo. When they overdo with repetitive micro trauma, we have a new injury that's going to heal slower and with less quality than the first injury. If I owned an insurance company, that would be one thing I would be very picky about. Please list all prior accidents. Where was the injury? When did it occur? What is the current status? I'm not going to insure you. Why? Because if you get hit, you're going to have way more damage than your grandson who plays football, is in good shape, has never had a car accident, never been sick. So you're both in the same crash. He has far less damage than you do. Does that make sense? Mm-hmm. Now, if he hasn't ever been in a car accident and does what your grandson did and rolls the vehicle multiple times, is in big trouble.
And then wheelies over his motorcycle and rolls himself down the road multiple times.
And lives?
A few weeks after.
If he lives, that's good.
He got brain damage the first time.
He has problems.
I had a patient, a good Christian lady with her children, I think there were 3 of them. They were driving to Kansas City to a church youth meeting. They had a Suburban and a trailer on the back. And they got into a rainstorm and they were going too fast and the trailer whipped and they rolled, they went off the road and the trailer came off. The Suburban rolled and tipped. She broke her neck. The atlas vertebra broke. The odontode broke. I got a call from the hospital, from her husband. What do? They said, don't move her.
Yeah.
And don't let him do surgery. It's too soon. Just keep her totally immobile.
So
If
they
it's
always want to do surgery right after the accident. So how do you say don't do that? I mean,
Say don't do that.
they'll kick you out of the hospital first.
Well, unfortunately, when you go in, you sign things that say you can do whatever you want to do. But in this case, even the doctors didn't want to go in there because they could have done major damage. So she had ligament tear, she had tendon tear, she had muscle tear, she had bone fracture, multiple, she had bleeding, she had a lot of stuff. The best thing for her was to not move it. And she healed fine. They never ever did surgery.
They put her in a striker frame?
Nope.
No? What did they put her in? Anything?
They let her lay.
So while the head healed, how did the other, did they have to do things on anything else?
Not then, because they all, again, when you have that kind of a trauma, they prioritize tissue and location. So, anyway, she did fine. And I totally believe, and they did a testimonial online and published it, that God was very, very involved in her recovery. And I totally agree. It's a very faith-promoting crash. It's a hard way to get faith, but it worked for them. 7, stabilizing or becoming one with the vehicle reduces the degree of damage from the crash. True. 8, the best position for headrest is 1.5 to 2 inches above the center of the head and within 1 inch from the center of the head.
True.
True. Choose the best time and location of balance bars and night lights are
Or the wall,
A,
in the tub and
A,
shower area, stairways,
C,
toilet.
D, E, and you can add F.
All of the above?
No,
Not me.
Not after
B,
being.
not B.
Oh, I misspeak.
Too late.
Yeah.
I
Well,
guess
that helps you move around
that's
after
a-
you've
that's a
been
good-
broken.
yeah, that's a good time, but it's not the best time. Number 10, any head or pelvis collision can cause jamming and or misalignment, which can lead to delayed effects from compensatory adaptations. Does that make sense to you? Does the question make sense?
Yes.
Compensatory adaptations. Let me comment on it just a little bit. Let's say you have, by divine design, you have primary tissue that has certain job assignments. They're made to do certain things, but they get damaged. The body always has secondary backup tissue to help in case the main one doesn't work. Less efficient, but it still works.
Mhm.
You also have tertiary, other compensating tissue that pitches in. Now, it's not near as effective, not near as efficient, but it keeps you going. Would you do me a favor and take my phone and find the picture of Joe Peterson walking. Okay, number 11, the practice of counter-stressing shortly following a collision. I could have been any trauma, anytime you exceed tissue tolerance can reduce the negative effect of the collision or negative injury, as well as the compensations due to the tissue, the stress tissue. If you stub your finger in a volleyball or a basketball, okay, I'm going to show you this lady. She used to be a patient of mine. She had a very bad car accident. She lives in Colorado right now. I'm going to just show you how she walks. Now she has a chiropractor and an orthopedic doctor right now. I'll show you, I'll bring it around.
watch people walking down the street like that.
Wow.
And they said she was doing fine.
I said, Joe, do you hurt? She said, I hurt all the time. I said, where? She said, everywhere. I was most interested in what's happening to her knee.
Mhm.
Her knee buckles sideways every step. I said, tell me about your knee. She said, oh, that's my artificial knee.
Like Joel's.
I said, they're going to redo it. Well, so I had some discussion with her. This is my daughter-in-law's mom, my oldest son's wife's mother, at the wedding last weekend. So I gave her some direction and had her, first of all, we tried to balance her hips a little tiny bit so she didn't wobble quite so much. So you needed a left about that high to help bring her pelvis up. And when we got all said and done, what I told her to do, and first of all was to get an outside brace for the knee to protect it. She said, I said, has this helped you any? her answer shocked me. She said, "You've given me hope." She had none at that point before we had that discussion. Now let's talk about the concept of counter-stressing. If you stub your finger, you stub your toe, think of the physics involved. If you have a compression, from the laws of physics, what would you want to do with it?
Bullets.
Exactly the opposite. What if you spilled hot water on you? What would you do?
Cold water.
Cold water. If you jammed your head, what would you want to do? You know what to do. Loosen it up. Microcrania, the occipital release, the microcrania, recreate motion. If you go on a vacation and you take 3, 6, 9 days, and you eat different foods, you sleep in different beds, you stay up too late, you come back tired, how long does it take you to counter-stress the effect of the vacation?
Same time you took on vacation.
Twice
Exactly,
as much.
exactly. It really takes about that long.
Yeah.
To get back to where you were before. Number 12.
So that would be true.
11 is true, yes.
Pardon?
11 is true. We didn't answer that. We
True.
talked about it, we didn't answer it.
True. So counter-stressing is that's a concept, a general concept that applies to the whole triangle. If you get too much noise, too many people, even good people, you have a family you're around a lot of good people, you have a really good time, but honestly it's a stress. You counter-stress it by getting alone.
So what about college students and kids who sit in a chair so much of the day? Is there counter stress when they get up and go to lunch or recess? You know,
Every
what
hour.
about adults?
Get up and move every hour. I would do it.
You get up and move. That's why they used to have recess. The kids sit for an hour and they send them out and play. Now they
still get recess, just not as long.
number
They
12.
do everything wrong.
The use of anti-inflammatories and pain relievers can actually delay and reduce the recovery
Yes.
if used excessively. When I broke my hip, they gave me strong drugs to reduce the pain. I said, after about the third day, I said to them, I don't want pain relievers. I would like to know what happened to the tissue. If I'm going to overdo the tissue, I want to know.
Because it doesn't hurt.
Yeah,
When you're out of pain, you overdo. Because it doesn't
Exactly.
hurt anymore.
exactly. So I recommend the less the better. If you have dental work, you have any kind of a trauma. The one place I give leeway to is if you can't sleep due to pain, then take something to help you sleep. When we lost our daughter, the little girl in the blue shirt, she drowned on New Year's Day. And Audra and I had a friend in our ward who was a pharmacist. And on about the second or third day, he knocked on the door and he had a little bottle and he said, "Take 2 of these." And boom, first time we were able to sleep because of the emotional stuff that goes along with that kind of a deal. There's a time and a place, but don't take pain pills and go work in your yard or mow your lawn. Okay, any further comments or questions?
Do you write written excuses so we don't have to do that? So we can take them home and say, my Dr. Smith said I don't have to do that. Because here's my written excuse.
Just take them home.
Okay.
I've given you an excuse. If you need it written, you write it, I'll sign it. Don't re-injure the injury. That's a big rule. Don't re-injure the injury. And now you know why. Because it'll never heal as good the second time,
Yeah.
the third time.
Such a freaking mess.
So my granddaughter's had 3 concussions. She's 30 years old.
30.
Yeah.
So her head is probably deformed and not mobile, like it could be and should be. Now, it might take a couple of years to get it back, because if the head is crooked, so is the pelvis. Right?
I would imagine.
Any additions, Denise?
You covered it all.
Okay,
Thank you.
thank you.